We're both second-year medical students at New York Medical College, and we're both the Sign co-presidents this year for our Sign chapter at NYMC. So that's kind of how we started getting involved with AAN. We both organized attendance to the conference last year, so we kind of became a little more involved through that. And then I was also a participant in the Live Well, Lead Well program last year.
Like Ali said, we're both second-year medical students, and it was really her participation in that kind of spurred us to get a whole group of students to come to the conference in Philly last year. And then we wanted to just have our school Sign chapter be a little bit more involved in the national organization.
How did the pandemic affect you in your institution, and what you've been doing to try to maintain the education, or what has changed in your lives with the pandemic right now?
A lot of our classes have been moved online. All of our classes have been moved online, and clinical rotations for the third and fourth years have also been moved to online platforms. I guess as second year students, for us specifically, we're a little bit less affected because we only had, a few weeks of class left before we started dedicated study period for staff. And a lot of our lectures, most students already were watching online. So that wasn't as big of a change for us. I think one of the biggest things that students in our year are worried about has to do with whether steps will be happening or not when we're supposed to be taking it, and also how this will affect our upcoming rotations, depending on how long this goes on.
The third years were really, even the second years and the first years were really trying, waiting to just get in there and get involved in whatever way they could. Pretty much immediately from the time this started happening, people were like, what can I do to help? How can I help? What is there for us to do? We have a lot of ongoing projects that I also am just unbelievably impressed by our students for taking the initiative to do all of these things. The fourth years, I think, are feeling a lot of things. They missed out on a lot of celebrations, and it's such a momentous time for them that is really been lacking. I think, with the news about potentially graduating early, I'm not really sure how our school is handling that, but they are, from the students that I've talked to, at least the fourth years are ready to get in there as soon as they can.
Just for context, our school is in Westchester County, which was one of the hardest hit areas in the United States. So we have really been needing a lot of student participation, all voluntary, of course. So there's been several initiatives started by students in conjunction with the administration to help out with both telemedicine and also help out with temperature screening at our drive-by sites and helping out with reporting screening results to patients. So those are ways that our admin is trying to allow third and fourth years, and also first and second years, to continue getting clinical experience and allowing us to really be involved with our communities.
The different student leaderships at our school have come together, and we've been having nearly bi-weekly meetings, just discussing all of the problems that have arose, any issues, and kind of B, what we can do to address it. Community service and volunteering has been a huge common theme in all of these discussions. They created this system where everything is posted and all in one place, and then they've been sending out a daily email about volunteer opportunities. So I feel like it's really coming from the students having the connections with the members of the community who are asking for help, and then them bringing it to the leadership organizations, and then the information is being distributed to everybody via daily emails where people can just reach out and say, hey, I'm available, I want to do that. So I feel like the communication has been constant, and it is really coming from both sides. It's a yes and no. I think a lot of people were using outside resources and also watching the lectures online, so that component hasn't really changed that much. But there were still smaller group sessions. We had some gross anatomy components of gross specimens for like our organ systems that we're missing out on, as well as just we have these like 20 person small groups. And I think that clinical problem solving is a little bit missing. I think that they've tried as hard as they could. And I'm really impressed with the administration's adaptation to we use Zoom a lot. They're trying to have like interactive Zoom polling features to make it a little bit more engaging like it would be in person. That being said, I still think there is some small things lacking, but I think we're doing such a good job, and the school and the students have stepped up in so many incredible ways to have these outside activities. Like we have all these Zoom meetings within our, we have a housing system. So we have all these Zoom meetings within our housing system across the classes, kind of as check-in points to try to have social interactions virtually. And I'm really, really amazed at how much our community has stepped up.
A lot of schools are now putting a lot more clinical exposure into the first and second years. And so our preceptor visits were cut short.
Yeah.
We can't do any of the like standardized patient interactions that we would normally have. So those are the areas where we're probably feeling it a little bit more. As Nicole said, I'm on the Wellness and Resiliency Committee. So we've really been trying to figure out ways that we can keep the student body connected with each other, since so many of our students have actually moved off campus since all the classes have been put online for the rest of the school year. So we're trying to figure out ways that we can have social activities virtually still, such as virtual movie nights, virtual discussions with our mental health department have been really helpful, and also continual communication virtually with our administration and our faculty, who have been really great about addressing all our concerns. They meet with us, every week to address anything that is stressing us out, whether it's academic related or not. So that's been really helpful. And as part of Wellness and Resiliency Committee, we've been sending out a lot of resources to students and a weekly newsletter, just letting them know what events are going on, what admin are up to, what the mental health department is up to, and how you can contact them. And even, like one of our admins' wives got involved and is hosting cooking classes, which I think has been really great.
We also have at our school, we have like weekly yoga classes that they're still hosting via Zoom. And we have a housing system. We've been doing like virtual happy hours together that are kind of like COVID-free talk, so that we can take even just an hour of our day to not be constantly bombarded with it. I think that's helping ease some stress for some people.
I guess for me, this has been a really salient topic just because I am Asian American. And so I'm hearing a lot of the news and a lot of the things that are happening to people around the country and around the world who look like me. So I think one of the biggest things that has impacted me was being in the news and hearing from people I know about specifically healthcare providers who are buying into Zoomers, and a lot of racial biases that surround COVID. Just as an example, we all saw the New York Times article about the PPE situation. Mm-hmm. And one small part of that article was a text from a physician that basically was like yelling at the doctor and calling it the Wuhan virus, which, there were a lot of issues going on in that situation. But one of the issues that stood out to me was the fact that they were using these terms that are racially motivated. So I think for me, that was something that I saw as being detrimental to wellness in a few different ways, where, you're affecting the mental health of your healthcare workers because they have this added stress about attacks like that and about, physically violent attacks that have been happening around the country. So they have to worry about that for themselves and for their families, which has been, even more detrimental to their mental health. For me personally, my dad lives in Texas, and he saw a news article about a Chinese American family who was stabbed in a grocery store. One of our topics was about trust between colleagues and how colleagues should respond to each other in racially motivated situations. So we had a scenario of a racial incident in a clinic, and we were talking about the appropriate actions that your colleagues should take to protect you if you were, targeted in a racial incident.
Just with the experience of how much and how quickly we've had to adapt to moving everything virtually, and so far how relatively successfully things have gone, I do see this more as a trend going forward, both with medical school as well as just telemedicine in general. I know some of that infrastructure already existed, but especially for certain outpatient things, I see it as going pretty far. And I think it'll have really important benefits for the community, especially rural areas that don't have access to health. Having an internet connection is, in some places, all you need to improve medical care. I think that we'll try to further implement, at least I hope. I also think we're now more aware of how almost unready some of the places weren't ready to deal with this. And I don't know if anybody ever could have predicted that something to this extent would have happened right now. But I think, or I hope, it'll help for future preparedness in people. And there's a lot to be said about wellness of residents and interns as well, going through all of this and having to deal with this right now. So I hope it'll improve the way we all treat each other and the lives of our interns and residents and colleagues going forward.